Hello, everybody. I'm Rob Wallace. I'm an evolutionary epidemiologist with the People CDC, here with an update on the COVID-19 pandemic. We begin with global COVID. In the graph in red, the Johns Hopkins Coronavirus Resource Center reports a slight increase to 3.7 million new COVID cases worldwide for the week ending June 19th. The number of global weekly deaths, there in white, continues to decline, down to nearly 9,000 for the week, the lowest level since March 2020, when SARS-2 went pandemic. The number of vaccinations administered this week, there in green, declined to 56 million new shots administered worldwide. This New York Times map shows hotspots over the past week in the Americas, Europe, Asia, and Australasia. There in purple, Panama, Portugal, Taiwan, Australia, and New Zealand continue to be epicenters in average daily new cases per 100,000 population. This week, Chile, France, Germany, Greece, and Croatia returned to hotspot status. Over the past 2 weeks, Argentina, Italy, Great Britain, and Botswana also hosted increases in daily new cases. Here's a 7-day average of daily confirmed COVID cases per million people from the beginning of the outbreak on the left all the way to today on the right. We can see the spikes in cases when Omicron emerged in late 2021. The present hotspots we noted in the previous map are trending in different directions. Taiwan and Portugal's outbreaks continue onward, also clocking in at 30% or more in test positivity there in the brown. Australia and Finland appear to continue to enter a decline in cases after months in epidemic cycles. A few weeks ago, we noted that Italy and Germany appear to have their Omicron spikes under control. But this week, we see these two countries, along with France, have returned to hotspot status. Here we have COVID deaths per million people for these same countries over the course of the whole pandemic. We see many of these countries suffered worse death loads early on, especially before vaccines were made available, at least in some parts of the world. We heard earlier that the global death load was in decline, but it depends where you are. We see here that deaths are up in Portugal and Australia, and were until recently spiking in Taiwan. So the pandemic continues, not only infecting people, but killing people. The virus also continues to evolve. This is a family tree for COVID samples over the past 6 months, starting from the beginning of the pandemic at the center of the diagram and branching outward as SARS-2 evolves. We see in dark blues and purples the early variants like Alpha and Beta. In the light blue are samples of the Delta variant. We see that Omicron subvariants there in yellow, but especially now in the oranges and reds, continue to explore SARS-2's evolutionary space. Across the Omicron group, we find molecular changes starting from the root of the SARS-2 tree to the tips, numbering as high as 55 amino acid changes and 15 deletion. What that means is that the virus continues to evolve, along the way experimenting with the human immune system to the tune of nearly 4 million new infections a week during what governments worldwide are treating as the end of the pandemic. Turning to the US, this past week, COVID in the Northeast continued to decline in cases per 100,000 population. The upper Midwest also appears in COVID decline, but the rest of the country continues to host a rise in the floor of caseloads. The West and Appalachia host widespread outbreak. Counties along the Rockies, particularly in Wyoming and in the Four Corners, are getting hit hard. Single counties across the Plains states are pinpricks of high infection. Florida is getting slammed, especially Miami, as are Alaska and Hawaii. Puerto Rico continues to host its months-long island-wide outbreak. There are other ways of tracking COVID. The levels of SARS-2 virus detected in the wastewater that comes through our sewage plants, as reported May 31st to June 14th, shows here the Pacific Northwest, the Bay Area, and Colorado are reporting the same high levels we saw on the caseload map. SARS-2 is still high in Illinois wastewater, but like the caseload map, appears beginning to decline. While the Midwest and Northeast appears cooling off in the blues there are specific plants here and there that are detecting high caseload. The empty circles represent plants that are only starting to take samples, but we see that much of the country still doesn't host sewage testing. The changes in SARS-2 detected in these sewage plants over the past 15 days show some sites around the country in red with increases in SARS-2 detected over 1,000% or more. So while the Northeast in the previous map appears cooled off, there remain spots that have shown sharp increases in the past couple weeks, particularly in upstate New York. The Midwest and North Carolina, despite hosting Omicron outbreaks for months now, in some areas in retraction, also appear to be hosting new surges here and there. The Omicron variant has an ill-earned reputation of being a relatively harmless infection. Hospitalizations requiring an ICU bed were indeed largely flat for most of the country this spring and into summer, but we also see continued upticks of 1% and 2% or more ICU beds filled in the past week, indicated here in dark green and in blue. How much more than 2% the CDC does not report. We see new ICU increases out in Nevada, Utah, Idaho, and Colorado. Compared to last week, we see such increases in different clusters of counties throughout the South and Midwest. We see declines in the Northeast, Ohio, and Michigan. In April, ABC News and other outlets reported the Department of Health and Human Services ended the requirement hospitals report daily COVID deaths, overflow in ventilated COVID patients, and critical staffing shortages. Some U.S. states outright ended reporting COVID metrics, hospital bed usage and availability, and ventilator use. Some states turned to delaying COVID-19 numbers to reports on a weekly basis. Some hospitals followed the National Institute of Health's lead in changing definitions of COVID cases, including to only those patients that receive antivirals remdesivir or dexamethasone. So your infection wouldn't be counted unless you needed those drugs. So where are we overall as the CDC sees it? Here's the CDC's community level map, which, as we have discussed previous weeks, depends on the lagging indicator of hospital capacity. Hospitals only fill up weeks after an outbreak begins locally. Even when characterizing our pandemic in such optimistic terms, the US is increasingly moving out of a low level in green to medium and high exposure in yellows and oranges. We saw that to be the case in the Midwest and Appalachia a couple of weeks ago, but we see it now also in the Pacific Northwest, the West Coast, the Four Corners, the Rockies, Florida, and Hawaii. The CDC has tucked away on its website another marker of the state of the US pandemic. The community transmission map, showing actual community transmission, shows for June 1st, all of the US, save parts of New York State and the Great Plains, is in full transmission, with the Great Plains getting filled in by the week. So while the community level map, that map largely in green, shows 60% of US counties to be under low danger, this community transmission map shows 81% of US counties hosting high transmission. With such transmission, we see SARS-2, like on the global stage, evolving here in the US. We see here new variants first emerging and then dominating in cycles of every 2 months. The BA2 Omicron subvariant in pink was replaced by the BA12 subvariant in orange, which is now being replaced by subvariants BA4 and 5 in green, which together presently account for nearly 35% of new cases. Two dangers arise from letting SARS-2 run free this way. The first is that the virus may experiment enough to figure out how to emerge out of our vaccine's disease immunity, the protection the vaccines offer us from getting too sick when we're infected. This here is what is called an antigenic map. It tracks the antibody neutralization the vaccines provide in comparison to the circulating COVID variant. Other maps have shown that the Omicron variant BA1 evolved out from underneath a protection provided by being infected with early variants, like Alpha, Beta, and Delta. This map shows Omicron in pink has escaped the antibodies produced by the vaccine we've used to this point. That doesn't mean that vaccines are useless, just that they don't necessarily produce Omicron-specific antibodies. Moderna is reporting its Omicron-specific vaccine in development to be successful, but we are likely in for boosters for years, with no guarantee a SARS-2 on a 2-month schedule won't continue to evolve out from underneath that protection. The second danger is the long COVID any one infection may induce, or perhaps the accumulative impact of multiple COVID infections causes. On the left, the little graphs in red show all the hazard ratios of all the body systems that have been documented to be impacted. The long in long COVID isn't just the length of time of such an infection, but also represents a foundational transition from an acute respiratory infection to a chronic condition of often devastating impact. We're talking various combinations of cognitive impairments, ulcers, pulmonary fibrosis, embolisms, diabetes, fatigue, and many more illnesses in the list to the left of the human figure here. To the right of the figure, we see all the different drugs long COVID patients are found to be at higher risk of having to take. That's why the People CDC is adamant that all efforts must be made to implement a full array of public health interventions that keep all people, susceptible and well, from entering the horror of long COVID. And that's COVID This Week from the People CDC. You can learn more about the People CDC and read this week's COVID weather report at peoplecdc.org.